So hello, good morning everyone. I am Ivy Joy Cagorol Pabilana and I will be doing a lecture with the use of audiovisual presentation. So before I'm going to start my lecture, I would like to welcome everyone, especially our newly hired nurses of Surgeon General Hospital. So for today, my topic is all about IV cannulation. So I know that most of you are familiar with this already because you've been to different institutions. So the main objective of this lecture is to familiarize and refresh our nurses regarding the procedure. So I guess we should start. So first and foremost, what is cannulation? So IV cannulation is a technique in which a cannula is placed inside a vein to provide venous access. So the purpose of the said procedure is to obtain blood samples, administration of fluids, medications, parenteral nutrition. It's used during chemotherapy and for transfusion or administration of blood products. It can also be used for blood donation and dialysis. So before we are going to start in any procedure, of course, we must first gather all the necessary equipments. So for cannulations, we need the IV cannula, depending on what size we are going to use, Tegaderm, or for us here, we are using plasters, alcohol swab, gloves, tourniquet, IV stopper or tubing if there's a need to infuse IV solutions, splint especially for our pediatric patients, and heparin saline or drip. So these are the commonly used um, equipments. So for pre-procedures, of course, we need to check for doctor's order if there is really a need for IV cannulation and if we are going to infuse what kind of IV solutions. And then greet and explain procedure to the patient. Of course, we must first confirm the identity of our patient, so we must ask them to state their name and then proceed with the explanation on what procedure we are going to do. And then assess patient's level of consciousness and anxiety for us to determine if they can cooperate with the procedure or if there's a need for a assistance. And then lastly, provide privacy. So during cannulation, of course, we need to wash our hands and then select the site of pain. So we must remember that there should be no wound or rashes around the area because it's very difficult to secure our IV site if there are rashes. And then vein should be big enough, straight and soft, and visible through the skin. So these are the different veins in our hands. And then position patient in a comfortable position with arm on dependent position. And then tie the tourniquet 6 inches above the intended site. And then palpate for the vein. If not dilated, follow one of the following procedures. So we could gently tap over the vein, or we could stroke upwards towards the tourniquet, or we could also instruct our patient to close and open their fist. So of course, we should wear our gloves as a standard or a universal precaution. And then choose the appropriate size of cannula according to the patient and indication for cannulation. So it differs if our patients are pediatric, so of course we should use smaller size of cannulas, or for adults, we could use gauge 20, or if there's an indication for blood transfusion or if the patient is scheduled for an OR procedure, we should of course use a bigger size of cannulas like gauge 18 or 16. So these are our different sizes of cannulas. Oh, it's color coded usually. And then clean the puncture site with alcohol swab, 5 to 10 centimeter diameter, starting from the site out first and let it dry. Then press lightly the vein using the thumb of your non-dominant hand about 4 centimeters below the intended site. And then stretch the skin taut below the site of insertion with the thumb to stabilize the vein. And then hold cannula with bevel facing up and perform cannulation. At this time, we should inform our patient that we are going to insert the cannula and inform them also that they are going to feel pain. And then observe the presence of backflow, no hematomas or thrombosis. So in this part of the procedure, or checking the backflow, helps us indicate that we are on the site. And then connect the cannula to IVF or put stopper and flash saline. And then secure cannula with plaster or tegaderm. We should also indicate the date and time of the procedure, because in some institutions they have a policy that they should change the IV cannulas every 72 hours. And then discard all disposable items and sharps appropriately. And then of course, in any other procedure, we should always wash our hands after doing a procedure. And then we should document. So in documentation, we must indicate what type of procedure did we perform, the date and the time, the type of IVF used, if there's indication of using, or if there's an order of IV fluid administration, and of course if we have complications. So I'm going to play a short video of the procedure.
Hi there, I'm Andrew, one of the final year medical students. Could I confirm your name and date of birth, please?
Sure, it's James, 13th of December 1989.
Nice to meet you, James. Today I've been asked to insert a cannula into your arm. It's a small plastic tube that will allow us to give fluids and medication. It might be a bit uncomfortable, but it won't be painful. Is that okay?
Yes, it is, yeah.
Brilliant. Are you allergic to anything at all?
No, not that I know of.
Fantastic. I'll just gather my equipment and then we'll begin. If you could just lift your arms up for me, James. Okay, James, sharp scratch.
So that's the backflow, which it tells us that we are on the right side.
James, I'm just going to flush the cannula now. Do let me know if there's any pain. Thank you, James. We're all done. Are you feeling okay?
Yes, I am. Thank you.
Okay, brilliant. Thank you.
So that ends my presentation. If you have any questions, feel free to ask, or if none, then thank you very much for listening and have a good day.